Everyone. I think we're just about ready to get things started, so thanks for joining us today. I wanted to welcome you all to MGFA's Wellness Series webinar, MG and Occupational Therapy. My name's Jenna Mvalo, and I'm the Director of Patient Advocacy and Community Engagement at MGFA, and I'll be moderating today's session. Before we get started, I'd like to go over a few housekeeping items. We're thrilled to have such a great showing for today's event, and ask that you can remain on mute throughout the presentation. Please submit your questions via the Zoom chat located on the Zoom menu bar, and we'll answer them during the Q&A segment. Today's session will be recorded and available online. Now I'd like to give special thanks for the support of our Wellness Series presenting sponsors, Alexion, Argenx, Momenta, and UCB, and our supporting sponsor, Immunovant. We've got a great presentation ahead, and now it's my pleasure to introduce today's speaker, Dr. Samantha Vlasic. She is an assistant professor of clinical occupational therapy at the USC Chan Division of Occupational Science and Occupational Therapy. Her clinical practice is conducted through the USC Occupational Therapy Facility Practice, where OTs deliver lifestyle-based intervention. As an experienced provider of lifestyle redesign services, she works with clients with various chronic conditions to support the acquisition of health-promoting habits and routines in order to lead healthier, happier, and more meaningful lives. Dr. Vlasic, I'll hand it over to you.
Thank you so much, Jenna. I'm so happy to be here today, and I'm just going to take a quick moment to get my share screen set up. All right, so thank you so much everyone for having me today. It's lovely to be here with the Myasthenia Gravis Foundation of America and all of you. As Jenna said, I'm Sam Vlasic. I'm an assistant professor at the University of Southern California, and just so you know a little bit about me, I work at a private practice in Los Angeles, and where we specialize in chronic condition prevention and management, mental health, and wellness. And just a little bit about that practice. We're located in Los Angeles, and if any of you have any questions about that practice, at the end of this, you can definitely let me know. But today I'm going to talk to you a little bit about what is occupational therapy and how as we all think about what I do as an occupational therapist and how we can use that lens to help ourselves get back to our routines, as they've all been very much disrupted by recent events with COVID and national conflict. So I'll just start with this. As an occupational therapist, what I really look at is how people occupy their time. So the word occupation, a lot of people think about, oh, that means that you help people find work, right? But actually what we mean by occupation is, how we occupy our time. And a lot of our time is our daily habits and routines. We spend a majority of our day engaged in kind of some of the same things on a day-to-day basis. So as you're thinking about, and we're talking today, I'd like you to reflect on some questions. How do you occupy your time right now? And how is that impacting your physical and mental health? And how is your health impacting the way that you spend your time? And these are the questions that I think about every day when I'm working with clients. And I'm asking them, how are you spending your time? How is that impacting the way that you're feeling? And are there changes that we can make either to your health or to the way that you're spending your time to make them mutually reinforcing, where, positive things going on in one area is leading to positive things going on in the other area. And that is the core belief of occupational therapy, that when we spend our time in a way that is meaningful and health promoting, then it's the way that we spend our time is the way that we feel about our life. And we actually do improve our health through engaging in meaningful activities. And so just so you have a little bit of background about that, the kinds of services that occupational therapy provide, they can be this in yellow, you see habilitative, and that's basically meaning it focuses on helping people attain or improve skills and functions so that they were able to engage in the things that they want to spend their time doing. It might be rehabilitative, where people are regaining skills or abilities or strengthening things or improving things that have been lost or compromised due to a result of disability or illness or injury. And we also can focus on the promotion of health and wellness. So just generally, not necessarily just about getting skills or abilities or strengths, but also promoting that sense of like, okay, I'm doing well. If any of you have worked with an occupational therapist, there's many different places where you might see us. We can work in a variety of settings, in hospitals, in skilled nursing facilities, outpatient clinics like where I work. They might be in schools or universities, wellness centers. They might be coming into someone's home to help them gain those skills in their home. And so it's really work that happens across the lifespan. So it's not just, working with one small set of people, but really looking at how do people spend their time across their lives. And for children, that might mean play. For a lot of adults, it's like, how do we engage in like the normal roles of, being a parent or a worker or something like that. And as we age, making sure that we still have fulfilling roles even as we age. How are we helping people pass on their wisdom or maintain friendships, or like enjoying kind of the leisure time that'll in the US, a lot of our leisure time kind of might come towards, the end of life. So we really look at that whole spectrum. And in my clinic, what we especially focus on is an approach called lifestyle redesign. It's this focus that's really on acquiring those health promoting habits and routines in daily life, so that way we can prevent and manage chronic conditions. And this is meant to be a really self-directed and personally meaningful process, where we're working with people individually to figure out what are those little changes on a day-to-day basis that are going to promote their health and enhance their quality of life. And so some examples of what that might look like are, we might talk about any of these different lifestyle components. So anything from, time management to physical activity, eating, but other things that take up time in our day. Things like managing our mood. Sometimes we have to take a moment to take care of ourselves or engage in some form of spirituality, or sometimes it's going to be playing chess or checkers, whatever takes up time in our day. But what do we mean by lifestyle? When I say lifestyle, it's the minutia. It's these little details of like, how much water are we drinking? What is the quality and the amount of sleep that we're getting? Are we overscheduling our day or underscheduling our day, so that we're overstimulated or understimulated? All of these things have a huge part in how we're feeling on a day-to-day basis and kind of the meaning that we make in our lives. And so when we're thinking about this, occupational therapists are really experts in the art and science of analyzing daily life and breaking down tasks. So we work with clients to break down the elements of what they do in a day and then help them to create strategies for habit and routine changes that are both realistic in the moment and sustainable over time in the context of their actual lived environments. So it's not about like, everyone needs to live this ideal lifestyle. Like there's one picture of what that might look like. It's really like, what do you want your lifestyle to look like? What do you think would be a good lifestyle for you? What makes you happy? What makes you feel accomplished or strong? Or, you just have like, at the end of the day, you look at your day and like, that felt good. And that's not, going to be the same from person to person. So it's really about individualizing these lifestyles. And so for a lot of clients who have MG, there are some common concerns that come up. So these are the ones that we might talk about for a lot of clients with neurological conditions. And so energy conservation and activity pacing, of course, it's like, what are those strategies that are going to be most helpful for making sure that we can limit how much energy we're spending when energy is limited. And energy is always limited. Literally all of us only get so much of it, but sometimes certain conditions make our energy more limited, and so we have to be even more careful about how we spend it. And so it's making sure that we can actually, you know, look at the task that you're doing and the home that you're doing it in, or the community that you're doing it in, and be like, okay, what are the tools that are going to be helpful, or how do we pace this the right way and break it down so it's going to be it's going to be more energy conservative for you. Another big thing, particularly I know with MG, is stress, and how stress can really exacerbate symptoms. So we work with a lot of clients to think about, okay, like, what are the stressors in your day? What are the ones that you're in control of, and what are the ones that you're not in control of? And how do we create habits and routines that actually promote a sense of wellness and relaxation through engaging either in things regularly to kind of keep our baseline stress low, or how do we like come up with things that we're going to do in the moment? Like, oh, something just happened. How can I deal with it in the moment and recover from that stress effectively? We might also talk about sleep, eating routines, exercise routines. I always think of these three as kind of like our core basic, like things that take time in the day, because each of these is so important for the foundation of our body and our mind and their ability to function. Like, we need sleep, we need rest, time to heal, time to recover, we need to eat, we need to have the right nutrients in our body so that everything can, you know, continue to grow. And then exercise to make sure that nothing's getting too stiff, or, you know, those sorts of things. And I know exercise, you know, when you have a condition like MG, it's like, okay, how do I do that in a way that's not gonna actually make things worse, you know, or spend my energy in a way that's not profitable for me? So it's really, how do I balance getting the right kind of exercise with the right kind of, you know, other activities in the day? And then body mechanics and ergonomics. So making sure that we're moving the body in a way that is safe and is making sure we're not going to injure ourselves, and making sure the ergonomics piece, making sure our home or our office is set up in a way to promote, you know, like, we're going to relax the muscles. We're going to, you know, make sure that we're not working in this hunched up position that causes a lot of tension. And this not just with, you know, a lot of times people think about ergonomics, they think about working at a desk, but this could be the ergonomics of your kitchen. This could be the ergonomics of your sewing station. This could be the ergonomics of your garden. You know, how can we adjust those things so that way they're most effective for you? And that really leads into that adapting the home, the work, and the community environment, making sure that we can make, it's not just that, you know, our clients need skills and strengths and abilities and knowledge, but really it's like sometimes it is more helpful to change the environment so that you don't have to like use all of that strength all of the time. You don't have to use all of that energy all the time. The environment is more conducive to being energy conserving. And that leads to, you know, sometimes we do home evaluations. During this time, during COVID, we've been doing a lot of telehealth home evaluations. So if you have an OT near you, you can ask about like, hey, can you use telehealth? And they'll actually, you know, you take your camera, you walk around your home, and they'll actually say, okay, here are some suggestions I might make to make adaptations in your home. And then leisure hobby, like, it's not just about getting the nitty gritty done on a daily basis where you're like cleaning and cooking and, you know, those sorts of things, but also making sure that we have fun and pleasure and joy in our lives. And how are we making sure that we're making that as easy for us as possible? And a lot of this takes that practical strategies for adjusting to changes in function. We know that a lot of times, you know, there's an emphasis in the medical model, like, okay, what's the medication that we can do, that we can use to like prevent that? And that's important. But sometimes there's like only a certain amount that's going to do. And then we need some practical tips of like, okay, this is the function that I have now, even with all of my best medical care. How do I adjust to that? And so that's a really big focus, is like looking at this big picture, and then like, okay, but in the context of the changes that are occurring, like what's going to work now that I'm experiencing all of these changes. So that's a little bit about OT, and I thank you for listening in on that. I hope that that there is an OT by you that you can work with. I'm a big, I like our profession. I think we're great. But I know that a lot of you today are here because there is a concern going on that with all of the changes, staying at home, and just fear of like communicating with anyone, and all of the kind of unrest in the country. There's just like a lot that has made our routines fall apart. And guess what? If you feel like your routine has fallen apart, you are absolutely not alone. This is basically, as soon as all of this hit and everyone was staying home all the time, like that was the first thing that I was talking to with all of my clients. Everyone was like, I don't know what to do with my day anymore. Like my day might have looked like this before. Like before COVID-19, I was like, I had this schedule where I was waking up and I was doing breakfast and I was getting something done and then eating, and there's a little bit of a schedule. There's people to see, there's things to do. And then after COVID-19 hit, it was like, I don't know, when do I sleep? I don't know. Is that between noon and 6 p.m. or when does that happen? When do I eat breakfast? I don't know. Like as long as I eat before 2 o'clock, right? So a lot of people had this moment where it was like, we're such social creatures that not getting to see each other just meant like we didn't have those anchors in our day. And those anchors are really important because like I was going through the research as I was preparing for this and looking at like, what is the importance of consistency? Why are these routines so important? And actually, it's not just about getting the right amount of things and not just about getting, the right quality. So like amount or quality of sleeping or eating, exercise, socializing, but actually the timing of these things does matter. And making sure that they're happening at the right times of day for us, which it can be individualized, and on a consistent basis in that way is really important. Consistency in sleeping can support our immune function, which we know with MG is a big concern, and it improves our stress management. Consistency with our eating routine helps us manage things like weight, cardiovascular risk, blood glucose, self-control even. By eating in a regular way, we don't have to exercise as much self-control when we're going from, time to eating to time to eating. Consistency with exercise improves our sleep and our mood. Consistency with socializing improves our overall health and mental health. And I like to emphasize this, all of this, in our bodies, we have systems that try to regulate us, some like our circadian rhythm and things like that, that are meant to keep us on certain rhythms. And we can actually use our daily habits and routines to make sure that those systems stay regulated. And when those systems stay regulated, it's like easier for the body to maintain itself, which is why a lot of these benefits occur. So what do we do? If we know that consistency is important, what are we gonna do about it? And so I'm gonna just start here. This is, usually the first thing when I'm working with a client, this is the first thing that I'm gonna recommend is let's observe. And there's something called the observer effect. When anything that is observed changes. As soon as we start looking at something, we're already doing it differently. And so what I say is, if your routines have fallen apart, if you're feeling like there's just like, I have nothing to hold on to and I don't know how to get back into that, just take a moment and reflect on routines that you previously enjoyed. Even if it was like, if you're working from home now and before you went into the office, like thinking about the timing of like, what was that commute doing for me? Like, what did I get out of that commute? Like we could get anything out of commutes, but we can't, that's not, for a lot of people, that was their alone time. That was like when they listened to music. So thinking about like, what are routines that you previously enjoyed that previously made you feel good? And like, how do we get back into that routine. So identifying like what's keeping you from getting back to that routine. Is it that, you know, there are kids at home? Is it that you have less access to the gym, or, you know, the coffee shop where you would meet up with your friends, whatever it is? Thinking about what are those barriers, and then we, you know, get creative thinking about, okay, like how could I do that in a different way? And that's something like you could find out on your own, or you might talk to with friends, or if you need to, you know, you could talk to an OT and they can help you do some of that creative problem solving. That's kind of like our specialty. And once you've thought about those barriers, I like to say, you know, if you're trying to get back into routines, a lot of times we need to increase our awareness of time. Everything right now that used to like make us aware of like what time it is, we no longer necessarily are getting. We don't have to be at the office, or we don't have to be certain places. We don't have to be at appointments. We don't even have to be at our doctor's appointment. We just, you know, turn on our computer and show up 2 minutes beforehand. So, you know, making sure that we have clocks in the right places in our home so we can, you know, think about, okay, guess it's time to eat now. Making sure that we're getting some sun exposure, particularly early on in the day. Sun exposure in the morning kind of sets our clock, our internal clock for the day. So actually getting sunlight in the morning helps us to sleep at night because our body's learning what that rhythm is meant to be. And then doing things like setting up regular appointments with family, friends, doctors, doing some online classes or online support groups like this. Or I've seen a lot of clients getting like online meetup groups, like things that are virtual but live. It's like, okay, if I want to see those people, I have to be there at a certain time to actually get to interact with them. So doing things that are increase our awareness of time. And then finally, logging your activities and mood hourly for 1 to 3 days. That's like, it's a really good starting point. So when you're able to like use this little chart here, you know, this is just an example. If you can take this, you look at the time, you write in what activity, and then you write down either like whatever is meaningful for you. What is the like, is it your energy level that you want to track? Is it your stress level that you want to track? And then you just circle like where you're at and they take some notes. And if you do that for a few days, you start to notice what's making me feel well and what's making me feel unwell. And a lot of times, you know, I'm always, when I first started doing this with people, I was like, I don't know what people are going to learn from this. You know, as a student, I was like, you know, but as you do it, you really, people are like, I didn't even notice. Like I had someone just this week who just noticed every time she had to get into the car, that was a major trigger for stress. It was like, oh yeah, I get really tense. I need to do some like breathing exercises while I'm driving or something. But these little things add up. It's noticing these little shifts in energy or these little shifts in stress that we can say like, okay, that's a small adjustment that I can make. That's a small incremental change to my quality of life. And through these adding up and through noticing like, oh, this was like a day that I kind of enjoyed versus this is a day that I kind of didn't, you can be like, how can I make more of my days just a little bit more like this? Doesn't have to be, you're already doing it. The nice thing about observing it and seeing that you feel better, it's like, I didn't even have to do anything special to achieve that. Like that was just a slightly better day. And let me notice that. So that these are kind of like the starting points for if you're trying to get back into a routine that feels good to you. It's really like thinking about what you enjoyed, figuring out what's getting in the way, getting back to having some time awareness, and like then looking at where am I at right now and what is working in what I'm doing right now and what is not working. And I think I'll just add a little bit to that. That I think another big thing that is occurring for a lot of people is that they feel like their mood is just down. You know, mood is down. I'm just like not as happy right now. And that's been really, really normal, of course, with all of these changes. And just for that, I say like, make sure you're giving your brain extra chances to remember how to be happy. Basically, with the neurological changes that occur with these huge shifts in environment and the way that we're spending our time, our brain can kind of forget, like, wait, how do you do that again? So we have to like have extra pleasure in our day and pay extra attention to that pleasure, to that joy, to that accomplishment. Even if it's like folding the socks in the sock drawer and admiring your work, like giving yourself the extra 2 seconds to enjoy that moment. So, I will end with, again, a reflection question. What is one small change that would make your day-to-day either more personally meaningful, healthy, or productive? It doesn't have to be that you're gonna all of a sudden start meditating on a daily basis. It doesn't have to be anything huge. It could be like, you know what, I'm gonna go back to having, breakfast before noon or something like that. Just thinking about what is one small thing, and it's always about that one step at a time. So thank you so much, everyone, for your kind attention. If you have any questions about occupational therapy or lifestyle redesign, or anything in the routines and lifestyle arena, please let me know. I have my email here, and this is my practice and our contact information. I'd love to take your questions at this point. And I do have some references. Yep. All right, so I will stop sharing now.
Thank you so much. That was wonderful. So one of the questions we have actually is it possible to get a hard copy of the information about the observer effect? Or is there a good place to locate that information?
Yeah, so I mean, I feel the observer effect, that's, kind of a metaphor. It's actually, the observer effect is something that comes from physics, where if you observe a photon, then it moves. So it's just a good metaphor, but it's something that we commonly see in practice as well. And I can find an article on the topic.
Okay. I think also maybe we can, if there's any templates similar to the one that you shared in the webinar, maybe that we could direct people to, so they can easily be able to print one and do their own exercise with it.
Sure, I see. Yeah. I can look into that. Mm-hmm.
Okay, great. Jessica has a question. As per your comment about noticing what makes you have a good day and trying to replicate it, the problem with MG is that the best of intentions can be aborted because of the unpredictability of the illness. Mm-hmm. Any suggestions about what to do about this?
There's definitely a lot of ideas, and I think this is a very, of course, case-by-case basis. But I think there are a few rules of thumb. I think absolutely listen to your body. Absolutely, like if you can feel like I've got a flare coming on, like that's not a day to push it, and maybe that's a day where you're not going to do your full-blown routine. You might need to modify it in some way. And so for that, I really say, like, get the rest that you think you need for that day, but then maybe figure out, like, is there a simpler, like, instead of going from like, if you can, like, sometimes you just need sleep, but sometimes like, okay, I could do a little bit, maybe like something lower energy, like, okay, instead of going to see my friend in person, which I know many of us are not doing, but like maybe we could do a phone call instead. That would still keep my mood elevated, but without spending so much energy. Or maybe, for a lot of this, it comes down to preparation. Like, okay, on days where I'm feeling better, maybe I will like prepare some things to have in the freezer. So on the days where I'm not feeling as well, like I still have a healthy meal option that I like can heat up, without having to cook. So some of this comes from preparation. A lot of it is the wisdom of knowing your body. And a lot of it is like that creative thinking of like, instead of just laying in bed and doing nothing, maybe there's something that, like, sometimes laying in bed and doing nothing is totally fine, but sometimes we know it's just like it's gonna make things worse for us. And we're like, oh, this doesn't feel good. So we might want to think of like, what are some things that I could do that are really low energy, that'll occupy my mind, maybe even if it's just like occupy my hands rather than my whole body.
That's great. Thank you. So another question is, what can you do to help with not overdoing it on days when you feel good?
Yes. That's a huge thing. I hear that a lot from a lot of people is that they bounce back and forth between like feeling good and then totally overdoing it, and that leads to the like overexertion that can lead to kind of some flare state. And so that again, I think of it as like energy in a picture. You get only so much energy each day. But the thing is, if you treat your pitcher like you can go down to zero every time, you kind of always want a little bit of water left in your pitcher as like seeding ground for the next day. So you want to think of like, if I've got this much energy, I need a little bit left over at the end of each day, because that's going to like seed energy for the next day. And so some of that is thinking about what are the demands of each activity. Like, is it a very physical activity, a very mental activity, a very like socially energetic activity? And trying to make sure you're not doing like all of your physical activities back to back to back, or making sure you're not doing all of your mental, really cognitive activities back to back to back. And like basically alternating between different types of activities and different intensities. Like this is a very intense activity versus this is a very mild activity, and alternating between those kinds of activities can help you. That's an energy conservation strategy that can help you not overdo it even on like a good day.
That's great. This is a question from Judy. Where do you find an occupational therapist, and is this something that insurance covers?
Absolutely. So this is something that insurance covers. Occupational therapy, physical therapy, and speech therapy are all in kind of those rehabilitative therapies. Of course, the type of coverage, the amount of coverage differs from insurance plan to insurance plan, but it is covered by Medicare and all of those things. So to find an occupational therapist, you could talk to your physician to see if they know anyone. A Google search is, another good place to go. But there's also the American Occupational Therapy Association, which can list OTs in your area. And each state also has a state occupational therapy board. So your state will have a list of occupational therapists in your state. So there are different options for finding people.
Great. Catherine wrote a message. She said, I'm here for my dad, and he tries to have a routine, but on some days he can do more than other days. So some days are days to rest. Mm-hmm. What type of exercises might help with energy conservation? So
it's funny because those are kind of two opposing things. So energy conservation is the idea that we can change our environment or the way that we approach tasks to actually save us energy in doing them. So exercises might be, I love this suggestion that's in the chat, like Tai Chi is great for learning conservation. Like Tai Chi is gonna help us learn to like move as little as possible through things and stabilize our muscles and not do anything extra. So I think that's a wonderful suggestion. But energy conservation is really about things like making sure that the thing you're doing is at the right height for you. Instead of having to reach up and do a lot of work or bend down and do a lot of work, making sure that it's really, energy conservation is about adapting the environment and adapting the task to the energy that you do have. So even if it's a day of rest, maybe like if your plan was to have some enjoyment of like, oh, when I wanted to do something fun today, maybe it is a day to watch a movie, maybe it is a day for something like that. And it's really, the idea is that if on your better days, it is you have more energy, you're conserving your energy a little bit, so you're not overdoing it, you hopefully will need less days of just rest. That's the idea, is like we're trying to balance it out and not go from one place to the other so often. It's kind of evening things out as much as possible.
Thank you.
Yeah.
The next question is from Joy. Do you have to have a physician's order for OT, or can you just go on your own and will insurance cover it?
So This is interesting. So in some states, occupational therapy does have direct access, meaning you can go without having a referral. However, a lot of insurances still require the referral anyways, even though like legally they could still see you. So like if you wanted to do private pay, you wouldn't need a referral in some states. So it's like a state by state thing. You would need to find out what's going on in your state. But so in most cases, you're probably going to want a referral from a physician. But it's really, the physicians that I've worked with, it's been pretty easy. It's just say, I want a referral for occupational therapy for the diagnosis of myasthenia gravis. Like that's it. Those are just like the two pieces of information that need to be on the referral most of the time.
Great, thank you.
Mm-hmm.
The next one is from Magnolia. I feel overwhelmed with doing a job at home. I feel like I do not have a schedule and end up working 10 or 12 hours.
Mm-hmm. Yeah, that's happening to so many people where there's boundaries are bleeding. And so because of the lack of boundaries, we're ending up working longer hours, and that can be really difficult. And so for that, it's some of it is kind of setting up what is my expectation for myself, well, how many hours do I want to be working? And sometimes it's setting up boundaries at work. How are we going to learn, like what is our limit and when to say no, and what can we say no to, what can't we say no to, when do we need to use a little bit of sick time to give ourselves like a time for reflection and healing. It's a tricky thing. I think the biggest thing is also having things outside of work to look forward to. A lot of times if we don't have things outside of work to look forward to, we don't feel like putting boundaries on work. Like we're just like, okay, I guess I don't have anything else to do, so I'll work a little bit more. So there's a lot of things going on there, communicating with your workplace, making sure there's a separate space, like there's a place in your home for work and there's a place in your home to relax, and they're not the same. You're not doing your work on your couch where you would want to be relaxing, things like that.
Yeah. So we've gotten just a couple of comments from Johanna and also Judy, just saying that they didn't understand the ins and outs of OT, and this has been a very valuable talk. It's awesome to see how much this can help the MG community, so thank you for it. We have another question about somebody has a family member who's currently in a rehab facility. She's receiving PT, OT, and speech therapy. And as a family member and healthcare advocate, what should we be asking about the OT treatment, and how can we help?
Absolutely. You know what? My family went through this recently ourselves, and my mom, my grandmother was in a rehab facility, and my mom took that opportunity. She's like, I want to learn, like from OT, like what the OT is doing, like how, if it's helping with like functional movement, getting in and out of bed, getting, like actually learning about like, what are the skills, because a lot of the times you're going to be there with your family member when all of these therapists and healthcare workers are not. So it's like, what are the skills that they are using to help your loved one engage in daily routines, and like being able to brush teeth, sit up, walk around, those sorts of things, making those transfers. So it's really asking like, hey, what, like, can you teach me? Can you teach me what you're doing? Because that is one of the roles of the occupational therapist, is to actually teach loved ones and caregivers, this is how you can support this person in being able to do the things that they want to do every day.
Great. Debbie says, due to the pandemic, I basically haven't been out since it began, other than doctors, etc. I just got done home care, PT, OT after my hospital stay. I start something, get exhausted, and leave it. Any suggestions?
Yeah, I mean, I think it definitely sounds like it's one of those things where like I would maybe talk, like get more support, because I don't know exactly what's going on. I don't know what you're trying to do. I don't know what your home is like. I don't know what your strength and energy is like. So I would say like, this is probably a good time. Like it might be a good time to get more services and like, hey, I still have questions about this. A lot of times like the support that we get in the hospital without carryover, like outpatient, like the nice thing about outpatient right now is it's all telehealth. So you don't even have to go anywhere. You can get suggestions in your home, which is really nice. And, you know, I would definitely advocate, like, let's continue to make sure that these telehealth services are available. I think that's the biggest barrier for a lot of people, even outside of COVID, is like, oh, you have to get in the car and drive somewhere. That's so energy intensive for people with fatigue to even like, it's nice when you can get this advice and not even have to leave your home.
Yeah. We're actually, one of our upcoming webinars will be on having a telemedicine call. So stay tuned for that. That'll be really helpful. Daniel says, I'm older, 66. I try to do things and do a lot of what you're talking about, but yet I still feel so weak. My muscles, I have been falling a lot and my muscles just give out. Any suggestions?
Yeah, I definitely think falls are a huge concern for all of us, right? That's one of the it's like the scariest thing that can happen a lot of times is falling down, because we hurt ourselves. So definitely I think OT can help. I think also getting PT involved as well. I think it's good. That's actually, they're a great team together, because the PT can focus on like what is going on muscularly, like for strengthening and things like that. And the OT can help make sure that like your home is set up in such a way and you have the right equipment to prevent falls. Making sure that like, because with certain equipment you might not have to bend over as much, or you know, those sorts of things. And for some people, you know, they're looking into like more durable medical equipment and things like that, and like getting the suggestions of like what's going to fit in your home, those sorts of things. Yeah.
Great. This is another question. This is from Judy. Is OT done at home or in a rehab facility?
So it can be done in so many places. It can be done in the home if you qualify for home health. It can be done in a rehab facility. Some people are being seen in a rehab facility right now if it's really required to develop like for the therapy that they're receiving. Some people are receiving it via telehealth. And some people, but it's also in hospitals, it's in schools, it's in skilled nursing facilities. So it's like, you're going to see us kind of, and anywhere where somebody's like learning or developing skills or like managing their health, you might see an OT there.
That's great. And I actually had a question. So when you were talking about the observer effect, I noticed that it's probably something that you traditionally tell people to do when they're going through a change, maybe a lifestyle change or the first visit that they're having with an OT. In a situation like now, when we could have consistency vary from day to day or week to week, how often do you recommend individuals stop and take time to observe their routine and what they're going through and the effect it has on their energy levels and mood?
Yeah, that's a great question. There are some people who, you know, I like to say like anytime you're thinking about making a change, it can be helpful. I have, there's an app that I like that actually looks at your mood and your the things that you're doing on a daily basis. It's called Daylio, Daylio. And so it doesn't look at like an hour by hour basis, but it looks like, you know, today, like here are the things that I did and here is how my mood generally was today, which is really nice. So some people like, I once used that app for myself for like several months just to like keep track of how am I, you know, how it was so easy. It was just like click a mood, click some things that I did. And it was easy to keep track of like, hey, what's keeping me happy these days? So it's something that you can do over the long term if you make it simple enough for yourself, or to do that nitty gritty, like hour by hour. I always say like, I never really want to do more than like 3 or 4 days in a row, because I feel like it's overwhelming to like track yourself hour by hour more than every 3 or 4 days in a row. And maybe doing that like every time there is like a plateau, like I want things to change and they're not changing. I think that's a good time for using the observer effect. If like things aren't changing but you'd like them to change, that's a good time to engage in like some observation, because it means that we might not be looking closely enough at what the issues are in order to make the change that we're looking for. And so the name of that app again is Dalio. It's and I'll type it into the chat. I really like it. I mean, I'm not associated with them or anything like that. I think it's useful.
Could you spell that?
Yeah, it's Daylio. It's great for just taking a look at like, what am I doing? How am I doing?
Wonderful. Thank you.
Mm-hmm.
So those are the questions we have today. So with that, I wanted to say thank you to everyone for all the questions you submitted and for your time participating in our webinar today. I want to say a special thank you to Dr. Valasek for a very informative session. And I wanted to let you know that MGFA will continue to be hosting this wellness series throughout the summer. So please be on the lookout for additional invites. Thank you all so much and enjoy the rest of your day.
Hi, Samantha. I wondered if I could ask you a question.
Mm-hmm.
I am currently an occupational therapy student at Rockhurst University. I'm in the second year of my master's degree, so I'm almost done, and we're working on a project about MG for class, and I stumbled across this webinar. I was like, this is perfect. But I wondered if I could get your email and possibly your references so I could look them up and share them with my classmates. And I wanted to know if you had any advice or anything you recommend focusing on in a presentation that you've learned from experience that you think it would be helpful for students to know about working with clients with MG.
Yeah, I mean, I think a lot of the concerns that people have presented today are like the key things. It is the, how do I maintain a routine when my symptoms are so volatile? And when they feel unpredictable. And I think it's really helping people, I think that there's like this fine line between total unpredictability and kind of knowing what are some of the triggers. And it's knowing that like some flares, like it does kind of come out of nowhere. And some flares, it's like, you kind of saw it coming because stress or overdoing it or whatever. And so it's helping people like, okay, maybe we can't get rid of the totally unpredictable ones, but maybe we can start to mitigate some of the things that like, oh, there were some triggers that were going on that were leading to overexertion, a lot of stress, things like that. And so it's like, I can't get rid of all of the unpredictability, but maybe we can mitigate some of that. And it's really helping people like touch in with their bodies and touch in with how they're doing and actually like honoring. Like I can feel the fatigue, like the lower level symptoms, the mild symptoms. And I know if I ignore this, it might get worse and worse and worse. And I think that's a big thing, is helping, you know, for a lot of people is just really getting into the subtleties and the nuances of their lived experience and paying attention to themselves and honoring their experience and saying like, you know what, I have wisdom about myself. And for me as the therapist, it's really about, I don't know your body. I've never lived in your body. So I know some general principles that can be helpful. And together we're gonna like apply some systematic observation to figure out like, what are the strategies that are gonna work best for you, because you have your own lived experience.
Thank you. And I've shared the email address one more time in the chat. So Brittany, feel free to reach out and connect for follow-up.
I got a question.
Absolutely.
I got a question.
Sure.
What if you part of your thyroid's hurting? What should you do?
If part of your thyroid is hurting?
Yes.
I think it's a good doctor question. I think because that's something that I don't know why your thyroid would be hurting. So it'd be probably good to talk about, like, that's like a special like diagnostic thing. I wouldn't know unless, you know, I knew what the doctor's thoughts about why that might be happening.
Well, I had it looked at, and they said, "Oh my gosh," but they didn't really say anything.
Endocrinologist.
Yeah, talking to you.
I was wondering, could a person live with a half a thyroid?
Let's see. I do. Go ahead.
Thanks. I think we have to make sure that for specific medical questions like that, we want to make sure that you refer to your doctor to make sure that somebody with the full picture is addressing the story. I wanted to say thank you once again. And with that, we're going to be concluding the call today. Thanks, everyone.